This is a patient that's had a L2 through sacrum fusion years ago and had metallic BAK cages placed. And then in the past year, especially the past 6 months, 7 months, severe back pain and leg pain to the point that they've had to use a walker. The patient, what happened here was they had a burst fracture and severely stenosed right here behind L5. So we're going to have to open this up and do a laminectomy here. Now we're going to have to go through some fusion bone also. You can see how this cage just drifted and fractured through, and then busted this vertebra and pushed back. The patient does have, you can see, fusion bone back here, a pretty thick fusion. So we're gonna have to come in from the back and take all this off. I don't think we're gonna have to do any other type of procedure here to stabilize it. These are the cages. This is all fusion mass down here. Massive amount of fusion bone. Here we are here coming through L3-4. That's their L3-4. And you see the dural tube is, quite large right here. That looks good. Then we come down here through, that's L4-5, and now it gets really tight in here. You can just see that's just super compressed. So we have to cut through this bone. And the rest of it's fused back here, so I don't think we have to worry about any kind of stabilization. So this patient has old incision that long. And we've got a burst fracture at L5. So we have to do a laminectomy. We're gonna start off endoscopically and most likely move to a tube with a microscope, but we're going to do some targeting and initially do our laminectomy through the endoscope. This is the patient from yesterday. I started out with a biportal endoscopy. I drilled into a bit and then it was getting pretty deep. So I went and took the tubes out, 18 millimeter tube in the microscope. And there's our decompression. The patient is up, walking, leg pain is gone, and doing great. Went home this morning, but I wanted to get a CAT scan before and just document what we had done. So patient's done very well, which is great news. And those are the soft tissue windows. These are what we call the bony windows. See more bony detail. You can see we're just like cut a swath, right through and across. Was able to even go across the midline and take care of the part of that you'll see right through here. Patient did very well from this. Very cool. Make her better. She's got enough problems in her life.